How's it on?
Yep.
Oh, it's on. Welcome, ladies and gentlemen, to Talks with Jody. Don't forget to like, subscribe, and comment below. Hit that notification bell to stay updated with the latest content. Let's go. Welcome, ladies and gentlemen, to Unfiltered Talks with Dr. Nadia. My guest at this time is Dr. Nadia. Answer. Nadia, welcome. Welcome to
Thank
the
you.
podcast. Because Nadia is a new guest, I always start my new guests with 2 questions as an icebreaker. Nadia, the first one is name one goal that you have set for the coming week.
Fighting the urge to make jokes, but survive and attempt to thrive would probably be a good goal.
Okay.
Just get through the week and stay committed to gym and resting and
Okay,
just
we're gonna.
surviving, I suppose.
No, that's good. Survival is most important, and we're definitely gonna dive into what are you talking about? Surviving what? So we're definitely gonna dive into that. And then the second question is name one person in your life that you are both thankful and grateful for, and why.
It has to be my mother, always.
Shout out to mom.
I mean, she birthed me, so grateful.
Yes.
She's the reason that I'm here. She is my support structure. She's
That's
always there for me. So, yeah, thankful for her. Always grateful for her.
No, that's good. Shout out to mom, and thank you, mom. Thank you, mom, for giving us Dr. Nadia. Let's dive into it. Let's dive into, because it's like the intro episode of you, and we the episode is called Unfiltered Talks. So we dive into why Unfiltered Talks. So before we get into the Unfiltered Talks, let's learn a bit about Nadia. Who is Nadia? What is your interest? What is your background?
So, I've always been a sporty kind of gal. Loved animals, even from kid. I think starting before primary school, I think we had cats, dogs. I think we had bunnies at some stage, chameleons. So my interests were always animals, and then my parents were very sporty.
Okay.
So they both played squash. My mother was a runner. My mother wanted to do karate, so started with swimming, and then at school went into karate, running, netball, softball, and
Nice.
took it from there. It's a little bit about my history, my upbringing. Yeah.
That's good. So very sporty background.
Mm.
That sounds good. And mom's a fighter as well, so.
Yeah. She's a bit spicy.
She's a bit And then let's dive into your educational background. So we're calling you Dr. Nadia. Why do we call you Dr. Nadia?
Well, I am a qualified medical doctor. 6 years of struggles later, and here I am. I can't say that I always wanted to be a doctor. I loved animals, so in primary school, that was my goal. I wanted to be a vet. Every year on my birthday, I had this book, and my parents would say, you need to write down like what gifts you want. Every year they would have to tell me it can't be something that breathes, because my list would be 5 cats, 5 bunnies. I want 5 puppies. And that's the list. So obviously I was limited,
So no animals.
restricted, nothing that breathes.
Okay.
So from there I wanted to be a vet. I job shadowed a vet in grade 10. And he discouraged me. He was like, you have to learn how to manage 9 species, and there's such a long waiting list, and you're not guaranteed work. So rather do medicine. It's 1 species. It's just the human. I mean, it's easier to get in. There's more universities. You're guaranteed a job at the end of it. So obviously when my parents found this out, they were also like, doctor, you can be a neurosurgeon, you're going to be wealthy, guaranteed a job, helping people. What more could you want? So I think it was a combination of being discouraged from what I wanted to do, from someone who was in that field, and like trusting that they knew what they were talking about, and like parental pressure of going this route. And also I was very academic, so
Yes.
it just fitted, you know. I wasn't going to waste my potential if I did something else. So in high school, worked hard. I was that nerd in the library during break doing my homework.
Extra
studying.
studying.
Yeah, you know, overachiever.
Yes.
Um,
Paid off?
it paid off. Got into medicine. Studied through UCT for 6 years. There were some difficult times, difficult exams. Got through it, and now I'm here. My first year internship, junior doctor. Still trying to find, you know, my place in the healthcare system, but I'm getting there.
Baby steps.
Yeah, baby steps.
And you've also learned that your journey thus far, nothing good comes easy.
Exactly.
Like you said, the exams, the late nights.
Yeah.
So no, it's good. I'm happy for you, and it's awesome. I'm sure you got so many stories to tell us with regards to the work background.
All the stories.
So talk to us. So you're qualified. What is the qualification called?
So it's a Bachelor of Medicine and Surgery. It's like a 2-in-1 degree.
Okay.
Yeah. So I only technically at the end of last year we graduated, but UCT just has their ceremony late. So I graduated in March, April.
Oh, gosh.
Yeah.
Oh, this year, sorry.
This year.
But you finished last year.
Yeah.
Okay, yes.
Yeah.
Okay. And now diving into your work experience. So you say you are an intern at which
So I'm at Victoria Hospital.
Okay.
So the way that it works is you study for 6 years. Different universities do it differently. So at UCT it's very theory based for most of the years. I think from 4th year onwards you start doing practicals and you're interacting with patients. And then the last probably 2 years is a lot of practicals. So not as many lectures, you're not sitting in a lecture hall, not as many tutorials. It's a lot of like
more hands-on.
Yeah, hands-on, and then all the studying is now, this is the textbook, you're going to go home after work and you're going to study on your own.
Okay.
So it's that kind of, I suppose, mentality of it's now your responsibility. You have spent 4 years learning all the theory, now you need to just apply it. And then you graduate, hopefully. And then you do your 2 years of internship. So you are, I was telling my friend yesterday, you're basically a student, but you're being paid. So you've got a lot of responsibility of doing all, I suppose, the scuttle work, like the dirty work, the bloods, the admin, all those sorts of things that the seniors are too specialized to do. I mean, I'm not going to expect a surgeon who does like abdominal surgery to do an ECG or to put up an IV line. Don't know if that makes sense.
I mean, explain to the viewers what did you just say?
It's like you can't expect someone who's cutting someone open and knows how to stitch the intestines and do all these weird and wonderful things to now type a discharge or like write up medication on a blue board for someone.
Yes.
Or, those are all small things that someone has to do, and because we're still learning and we're not qualified to cut someone's abdomen open, we do that. So as an intern, it's a lot of learning under supervision. It's a lot of admin that we do. So it's just to give us some sort of basic exposure to the different departments that we will be working. So we do pediatrics, we do general surgery, we do obstetrics, like Caesars and natural birth, all those sorts of things.
So you part of that process of the birth, and then what all do you do in that process? Is it from what? Explain to us, please. I mean, holding the mom and all that, around that table.
So we start our exposure to these things as students, and I think when I was in 4th year we had 12-hour shifts.
Sure. Student.
24 hours. I can't even remember.
Wow.
It's like 2 years ago, and my mind is just, it's not what it used to be.
Oh, really?
But you're involved with the process. So we were in 5th year, I think. We were assisting the natural delivery. So you would literally catch the baby. And
Wow.
you're part of the process from before, you know, monitoring that the mom is doing okay during the labor, baby's doing okay. You catch the baby and then you wait for the next patient. And then last year, we were involved in assisting with all the C-sections.
Okay.
So all.
So you do that? Cutting?
So no. So we
No.
don't. We didn't do any of the cutting. That's this year.
That, okay.
This year we need to do the cutting, but last year we literally just stand and hold the instruments. You know, we need to help push the baby out. All the small things that makes a difference.
Contributes
but
still
also,
to the bigger.
Yeah.
Yes.
So it's like slowly building up your responsibility level, and now as an intern, you need to take full responsibility just under supervision. So it's still a safe learning environment, but
Okay.
you need to be more competent.
So it is that balance of it's safe but still pressured.
Yeah.
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 And my next question, just diving on what you just said now, is you mentioned with catching the baby, holding the instruments. How does that make you feel? Is it like catching life or holding something that's contributing to creating life? How does that all feel?
I think at first it can be a shock. I mean, you're not used to seeing the sorts of things that you see when you see it for the first time, even in surgery. Like, you're not used to seeing someone's intestines.
Of course.
It looks like raw sausage. It's not something you're expecting to see from a human body.
Yes.
And now you are elbow deep in this person's tummy. So it's a combination of disgusting,
Number one.
shocking, and then also interesting. And I think the more you're exposed to it, the less sensitive you become. Like, you become very used to dealing with these weird and wonderful things that most people would just absolutely die if they saw. They'd pass out or they'd vomit.
How did you deal with it the first time?
I think I almost vomited the first
Really?
natural birth that I saw because of the smell. The smell was like soaked into my nostrils for 3 months.
Even though you've got the mask, still.
No, the smells are definitely something that can traumatize you. But there's a lot of other things, like we rotate through forensics. So we spent, I think it was two days watching autopsies. And I don't think anything prepares you for the first time you see something that graphic. I almost fainted.
Yeah.
Because it's like you know what you're expecting before you walk in there, but when you actually see it, you like it doesn't feel real, and it's almost like a shock to the system, knowing that this person that's laying there now was an actual person, like an actual living, breathing person a few days ago, and now this is them, and you're here to learn from them. It's crazy. So crazy.
Wow. I can only imagine the different emotions that you're going through. Like you said, you're coming into a new environment where it's no longer the book, it's no longer something that's let's call it staged.
Yeah.
In terms of the studying and sort of the practical in classes. Now being in the actual field, actually working with just the realism of it, I can only imagine how scary it must be.
Yeah,
and feel.
It's so unpredictable. You never know what you're going to walk into. So it's going to make you very anxious. I mean, depends on the type of person that you are. I'm quite a anxious person, so anything that's unpredictable, I'm already like
It puts you in
palpitations, sweating,
yes.
you know. So it's a lot to deal with, but life is unpredictable. So.
And it's also making you stronger because you're learning to deal with something new every time.
Exactly.
Yes.
And you get better with dealing with unpredictable situations. So I think it keeps you on your toes, which is a good thing.
Yes, we need that in life, especially. You and I spoke about it the other day. Was when we said like life gets too easy, and then we start becoming complacent, and like I say, nothing good comes easy, and you need to keep pushing. You need to keep striving when you've reached a goal, whether it's strength goal. you need to push to be better than that strength that you've just achieved now, or let's say your goal is to get bigger. Once you've reached that target, you might want to be bigger, and
Exactly.
you know. So I like that. I like it's. I'm pretty sure from your side, it's scary in terms of the new challenges, right? But it's nice to hear that from your side. I don't know what others are thinking, but that is making you stronger. That is making you more positive, more, because a lot of people, like you said, people are fainting. People, there's that negative reaction, and it happens. It's normal. We're human. We can't expect everyone to be stronger or come out stronger from a situation.
I mean, there's this expectation that you are a doctor, so you shouldn't be fainting when you see.
Shouldn't, but you know, that's what I'm saying. That's that expectation, but we can't expect every human to be the same.
I know. I mean, it's like an unhealthy, toxic expectation. Even this thing of wanting to be better. As an intern, can't speak for everybody else, but for me at least, I feel like I know nothing. I've got no idea what I'm doing. I'm just learning as I go. I'm asking questions. I'm trying to do procedures and learn from my mistakes. And I feel like it becomes almost like a toxic cycle, like we were talking about, just wanting to be better, and you're never satisfied because you're like never reaching your goal. And the thing is, as much as you want to improve your skills as a doctor, you're also never going to be, or you're never going to feel like you are good enough, because there's always something you can learn, there's always something you can do better. So it ties into that thing of like unpredictable situations. You don't know what you're going to face. You don't know if it's going to be exactly like the textbook told you it's going to be. So you feel like you've still got a lot to learn. I mean, toxic cycles.
But, and we're actually going to dive, I definitely want to bring you back on to talk about toxicity in the field. But just coming back to what you said about like a doctor or anything within the medical staff, you don't always know everything, right? Do you feel like it's healthy to have that sort of mentality of, I'm not always going to know everything, I need to strive, compared to somebody that's always, let's call it a know-it-all. No, I know that, I know everything. Do you feel it's healthy? And my question is, do you feel it's healthy not being satisfied?
I think to a point, yes. You've got different types of people. So you've got someone who's, let's say, confident. Let's not go with arrogant. They're just very confident.
They're separated too.
Yeah, they know how to do certain skills, procedures. They know their theory. They believe in themselves that they can manage the situation. And then you've got someone who's completely arrogant, and they maybe think that they can manage a certain situation. They think that they can do things, and they often have this ego surrounding themselves. So when they struggle and when they can't, they're too scared to ask for help. Then they're sitting in a situation where it's dangerous. It's dangerous for them and the patient, because you've got someone's lives in your hand.
Of course.
And if you are too scared to admit that you're actually not as competent as you thought you were, you're struggling, you maybe need some help, and you don't want to ask for help, you're putting yourself and your patient at risk. So there's those two different people. Confident, always better. I feel like someone who's confident, they're not afraid to ask for help. They're not afraid to try to learn from other people. They're not afraid to put the ego aside and admit, like, I thought I could do this, but I'm actually really struggling. Can you please help me? Whereas someone with ego is just like, I know what I'm doing. Don't even question me. Don't even try to give me advice because I know better than you, kind of thing. And I think that's very dangerous. And then on the other side, you have someone who's like me. You feel like you don't know what you're doing. You're not as confident. And I've been told by my seniors that I need to trust myself more because I do know what I'm doing. But I think I'm just more on the cautious side of, I know I've got someone's life in my hands and I don't want to mess it up. So I'm more willing to have someone stand with me if I'm unsure and guide me through something or ask questions, as opposed to just, let me just try this. Let me just see what happens. Let me try it. Yeah. So it's like three different people. It's like a spectrum, and I think it's healthy to be on the confident and willing to ask for help side versus the I know what I'm doing, don't even try to tell me, versus also where I think I am is like you insecure and you feel like you're not competent, so you almost like relying on someone to just always be there next to you, just in case.
Something like you hold back and it's like, please assist.
Yeah.
But I like what you surrounded confidence by. Two big things that I picked up from you is the admitting part, because for me admitting is always brave. That's confidence. Admitting I don't know. How do I know? Stuff like that. And the whole being a student, continuously be a student in the game, and not just be that know-it or I think I know it. Just continue to learn, continue as much as you know. Maybe you an expert of something, like let's say your art of training, you know how to do this skill and that skill, but you're still a student and you're still going and learning, checking out tutorials. So I like the two things that you surrounded confidence by, is the admitting part and being a student, asking questions.
I think it's important because no one knows everything.
No.
And especially now as a junior doctor, we're still learning. The medical field, it's just one of those things where it's constantly evolving. There's constantly something new to learn about. I mean, look at COVID. We knew nothing. We knew absolutely nothing about COVID, and now we're trying to adjust. We're trying to overcome. We're getting there. So there's always potential for unpredictable situations, unpredictable viruses, pandemics. So there's always time and opportunity for learning, and I think it's a good reminder for us that we need to strive to learn more, but also not feel like we aren't good enough and we're never going to be good enough, and then become scared to try and scared to learn. It's like finding that healthy balance,
Of course. And I mean, you mentioned now the whole COVID thing, something new, it's a new virus. It's out of our norm, like with everything we do. Do you feel like that is a perfect example of just the way the world is moving in terms of something new will always happen because people are always trying new things, just new? Or do you feel like COVID is an example of that? Like you said, now in the medical field, you guys are always learning. There's always something new.
Yeah.
So why is it new? Is it because of everything around us is new? Everything is different. People are always trying new. Do you feel like that's contribution, or is just as a luck of the draw, just something new just came up, a new virus, new random?
In certain aspects, it can be because of our actions that new things come to light, but other times it's unpredictable. I mean, viruses on their own can mutate, and it's not something that we can actively do. But I mean, there are things that humans can do. Our actions cause consequences, and then we end up with situations that we weren't expecting, and now we have to kind of like put out the fires.
Yes.
So yeah, it's a combination of the two. It's never a clear-cut answer.
That's why I asked you, because on the one hand people will say, no, it's because people are playing with this, and it's like, no, it's just nature. It's like, I like that answer. It's a combination of the two, because people always give that concrete answer, like we'll take the Facebook doctors, everyone has this answer to the cures, to how it started, to everything. But that's why I'm asking a medical expert, and what is your views? I mean, sometimes we don't always have the right answers, but we do have our views. And
I think if med school taught me one thing, it's that whenever someone asks you a question, the answer is always, it depends.
yes.
So it depends on a lot of things. I mean, small things on the ward rounds, they ask you, well, what is your management for this patient? It's going to depend. Depends on how old they are. Do they have other health issues that I need to know about? Are they currently on a treatment that's working for them? Is it not working for them? Lots of different aspects that's going to play a role in the answer. So it's never clear cut. It always depends.
I like that. It always depends. Well, that sounds good. And yes, I think my next question to you would be, talk to me a bit about the different, what do we call it, different fields that you work in, like the surgery, the pediatrics, the ward. Talk to me about it.
Okay.
What is your experience so far that you've...
So, internship is 2 years,
Okay.
and we rotate through quite a few departments or specialties. For the first year, it's usually 3 months in each. So I started with pediatrics, which is kiddies, where we spent 2 months with with peds or the kids, and then we spent 1 month with neonates, which is babies. So I'll dive into that now.
Okay.
But after that, I'm now in surgery, so we do general surgery for 3 months. After this, I'm going into obstetrics and gynae, so pregnant women, C-sections, giving birth, all those sorts of things.
Okay.
And then more gynae issues, so just general female reproductive issues. After that, I go into medicine, so that's probably everything else that you used to, pneumonias, diarrhea, all the weird and wonderful things.
The weird and wonderful.
All the weird and wonderful things is what I'll be seeing. And then in our second year, we deal with more smaller specialties, and it's 2 months. So it'll be 2 months in psychiatrics, it'll be 2 months in orthopedics, which is like bone surgery, bone doctors, the fun stuff.
Yes.
The construction workers of healthcare.
Okay.
It's because when they do surgeries, they literally have like hammers and drills, so it sounds like a construction site.
Yeah.
Wonderful.
Construction side of the body. Oh, wow. Okay.
And then we do other things like the anaesthetists, so the ones in surgery who put you to sleep and wake you up afterwards. We spend 6 months at the smaller clinics, and we do time in the emergency unit. So it's it gives us exposure to everything that we could possibly deal with when we are in our community service here. Because it depends. You can do your community service in certain specialties, like you can do 6 months in neonates and 6 months in obstetrics.
Okay.
So at least you have a broad idea of, what you're doing. But you could also spend a full year in the emergency unit where you are the person seeing the kids that come in sick, the old people that come in sick, someone who's needing surgery. So you also have an idea of, I've seen this before. I was in peds for 3 months. I remember something like this. I know how to manage that.
That's
so
good.
give you some sort of foundation to build on. So far my foundation is peds, neonates, and surgery. My pediatric experience in university was not great. I didn't enjoy it. I was at a hospital where it was like very specialist level. I was in a ward that dealt specifically with kidney issues and brain issues, and not simple things, like complicated things that at my level
You're thrown in the deep end,
I mean, those were things that I just thought to myself, as an intern, if I am in the emergency unit and this kid comes with this kidney issue, what am I going to do? I'm literally going to admit them and refer them onto the specialist unit. It's not something basic like, this kid is having a seizure, how do I stop it? This kid is dehydrated, how do I fix it? This kid has pneumonia, how do I manage pneumonia in a child? So those were things that I didn't get experience with in my rotation, and those were things that made me feel very I was so insecure when I started peds. I felt as if I didn't know what I was doing. I was scared to manage children because, they're not fragile, they're quite robust, but it's someone's child, it holds a lot of weight and a lot of pressure and a lot of responsibility. If something goes wrong, it's someone's 2-year-old child versus a 90-year-old who's, people are expecting their time is going to come soon. So I was very scared when I started. I learned a lot. I was thrown in the deep end because I came from not knowing how to do things to now getting exposure to all of these basic things that I should have gotten exposure to before. So it's basically, I was quite scared to treat children now. There's just a lot of extra responsibility and extra pressure because if something happens, it's someone's 2-year-old, and you have to tell the parents, whereas if it's a 90-year-old, people are kind of expecting their time's going to come soon. So it's a lot of pressure, but I was thrown into the deep end. I was exposed to a lot of basic conditions that I should have been exposed to as a student: pneumonia, diarrhea, dehydration, all those sorts of things that is the foundation of managing kids. I got exposure to, and the environment that I was in, the doctors that I was with, they were so supportive, and it just made it a much better environment for learning. I never felt like I was alone and I just overwhelmed and I didn't know what I was doing. There was always someone who was guiding me through, letting me take the space to try. If I need help, they're there. If I need to ask anything, they're there. Constantly teaching me, these are the basics. This is how you save someone's life. So I really enjoyed my 2 months in peds this year. I feel a lot more confident with managing certain conditions in children, managing emergencies, basically just healing kids. And then my 1 month in neonates, also an interesting time, a bit more stressful.
Okay.
Because, so in peds we are on call alone as the intern. Your senior's on call from their house. So if anything happens, you phone them, they come in. But the emergency unit doctors are there if you need anything. It's just this feeling of being alone. You're the only one in your department that's here, so it's kind of isolating and stressful.
Carrying a lot of responsibility.
Yeah, I mean, it's kids.
It's kids.
You're managing a ward of like 20 children,
Yes.
so if something happens, you're like, and you've got 2 months of experience managing kids. So it's scary, but I think it was good for competency and confidence.
Mm-hmm.
And then going into neonates, you're not on call alone. So I was the intern with a community service doctor, with a senior, and then another senior from home. So there were always 3 of us at the hospital. So if anything happened, there was someone there to help. I think the scary part was, as a neonates intern, we have to be present at all of the C-sections. And at night, it's not elective. So it's not someone who wants to have a C-section, so they've now booked, okay, at 38 weeks, I'm going to come in and have a C-section, the good stuff. It's not like that. It's emergencies at night, the baby's not looking so good, the heart rate's dropping, you need to cut them open now, baby must come out. Those are the ones where things go wrong, and babies are fragile. Kids, robust. Babies are fragile. So I think there were 2 or 3 C-sections where I was alone. Usually the community service doctor's with me, but she had to attend another birth. Wow. So I was alone, and things did not go well. Like, the babies came out, they weren't breathing. I had to start CPR alone, call for help. So things go south very, very quickly. It's quite stressful, but I think after experiencing it once or twice, I felt a lot more confident, knowing like something's going wrong. I need to call for help now, and I need to start my management like right now. There's no time to wait, because with kids, every minute that goes
counts.
by, it's like the chance of survival just drops.
Yeah, the longer that you take to react, to respond to the emergency, right?
Yeah.
And you told me like once or twice this happened to you. How did you cope? Just like talk me through that scene of how did you get through it?
Okay, I can give you an example. The traumatic ones. Let's talk about trauma.
Yeah, let's talk about it. The juicy stuff.
So it was in the middle of the night. My ComServe was called to, I think it was an assisted delivery, so wherever they need to use a vacuum, just basically it's like a vacuum cup that they put on the baby's head to help pull them out.
Yes.
Or they use basically like, it looks like 2 giant spoons that wraps around the baby's head to help pull them out. They need to have a neonates doctor there just to make sure that because the baby was stuck, nothing went wrong and they're still fine. Just in case they need a little bit of oxygen or a little bit of stimulation once they come out. So she was assisting there, and I went to theatre alone. Before the C-section, baby was fine, the heart rate was fine, so we weren't really expecting, a full-on resus. But when the baby came out, the baby wasn't breathing, and I was alone. And this was the first one where I was alone and the baby wasn't breathing. So I've got a nurse that usually assists. So the nurse takes the baby from the obstetric doctors, the ones that do the Caesar, puts the baby on the little warming table.
Yes.
And then, we start working together to dry the baby and whatever. So as soon as the baby wasn't breathing, I told her, please call the senior. And I think there was just a little bit of chaos for me because I was panicking, this baby's not breathing. I know that my senior is busy with an emergency as well. And every minute counts. And every minute without oxygen to the brain, babies' brains are so fragile, and without oxygen, the damage is permanent. So it was quite a stressful situation. Starting with, you have to follow your guidelines of, okay, you need to first dry and try to move the baby. The typical of you smack the baby. It's a gentle version of that. So you try to stimulate the baby, try to get them to breathe. If there's a lot of secretions, you need to suck out the secretions. You start giving them oxygen. If their heart rates are low, you need to start CPR. So going through that whole process while waiting for help to arrive, and I went from the drying all the way to starting chest compressions on my own. It was probably the most stressful 4 minutes of my life, and it felt like 5 hours. And the fact that I was waiting and I'm watching the clock, okay, it's 2 minutes now. And okay, it's 3 minutes, she's not here yet, it's 4 minutes, so what do I do? Because we are trained to manage further, so we trained to intubate, basically to put a pipe down the airway so that we can breathe for them essentially. But it's not something that you can do alone, me alone as a doctor plus the nurse. Someone needs to do chest compressions, someone needs to put a drip up for this baby in case we need to give them medication, someone needs to be managing the airway, giving the oxygen.
Some more hands.
Yeah, you need a lot of hands. Even though it's a tiny person that's this big, you need 3 to 4 people. So that was...
Do you get that sort of luxury or not?
You do when help arrives.
Okay.
But it's 3-4 minutes, which is nothing. It's like someone walking from a few meters down to get to where you are. But in the moment, you're
losing.
It's the difference between this baby surviving and this baby ending up with severe brain damage versus not surviving. And I think that case was traumatic for me because once my senior arrived, she immediately called the senior who was upstairs, who came down, and it was a whole process of this baby was intubated and we put up drips and the baby went to the high care. And because the baby didn't have oxygen for so long, and so there were a lot of things, but essentially the lack of oxygen to the brain caused quite significant damage that just wasn't able to be repaired. So 2 days later the baby passed away. So it was just a lot to deal with. It was definitely a learning curve. Learning how to deal with stressful situations alone and trying to keep you cool, follow the process, which is something they try to drill into you at med school, but also feeling like you're alone. Even though there are people there, it's just you and this patient for 4 minutes, and that 4 minutes means so much. So that was probably the most traumatic learning experience I had in neonates.
Learning the hard way type of thing.
Yeah. It happened again when I was alone, but I think it was easier because I'd been through it before. So it was easier to manage and recognize, okay, I need to call for help right now, kind of thing. Yeah.
What I've learned from your experience about having that responsibility of life is that every second, every minute counts.
Yeah.
with regards to life.
Yeah.
And like you said, if even just from calling for help, that time they spend coming to you to assist you, that's time lost, seconds, minutes. So I'm really sorry you have to go through that experience, and also thank you for sharing, and thank you for being a part of life. Because if I listen to what you've mentioned about taking care of newborn babies, taking care of the mothers, and taking care of life, just in the pediatrics, everything you've mentioned, cutting up the body and everything. I think thank you for your services. Thank you for being that, let's call you the backbone of just life in general. And I'm sure the viewers at home are listening to your story and also appreciating you and what you do for us. I'm gonna say us, because you never know, I might have let me not jinx myself, but you never know. Yeah, don't say it, but you never know. I could be that person, the person watching at home could be that person in the hospital, and you could be assisting us. We don't know. And at least we know at that time you'll be so experienced, you really know what to do.
Yeah, I think a lot of people who aren't in the medical field don't know what you actually go through. Like, after that experience, I went home and I told my mom, like, I had to do a full resus alone, and the baby's in the high key unit, and we don't know if this baby is going to recover, if they're going to survive. And for someone who doesn't really have an idea of the context, she's just like, I'm so sorry, it must be stressful, but you don't see what I've seen. So I think a lot of people don't fully understand how traumatic something like that can be. So they don't understand that, like, if you're my patient and you're waiting for, I don't know, medication, you don't know that 2 minutes ago I just did a full resus on a baby. The baby's, didn't make it, and now I need to compose myself quickly. Okay, how can I help you, kind of thing. So there's a lot of
you don't get a chance to process things and to.
It's such a high, volume or high output, quick paced life,
Yes.
that you don't get the time to just debrief. What did I just experience? What am I taking away from that? All of that happens after your call. When you get home, you're just like, okay, what just happened?
Wow. That is a lot. That is unfiltered. But Nadia, what I want to do is, just going forward, I definitely want to bring you back. I want to learn more about the mental health, what you guys go through mentally, and also advice. I think we just target those two, as mental health and advice. Is there any advice or anything you would like to leave the audience with?
Don't do medicine.
Don't do medicine.
I'm joking. I'm not joking about it.
That's the joking advice. What is serious advice?
I think that you just need to know, it's going to apply to everything that you do. You just need to know what you're capable of doing and when to ask for help. And knowing that as good as you are at what you do, there's always space for improvement. There's always opportunity to learn from someone who's maybe got a bit more experience, who's seen some more things than what you have. And yeah, you shouldn't be afraid to ask. No one's going to deny you help just because you're asking, or just because you don't know. People are very willing to help you. You just need to ask. Yeah.
I like that. Guys, I hope you enjoyed this episode. And yes, we'll definitely have Nadia back to chat to us more and just learn more about what goes on in the medical field. So guys, don't forget to like, subscribe, and comment below if you have any questions for my guest Nadia. Any questions you would like to ask her about the medical field as well. So guys, till next time, peace.